Welcome to my YouTube channel. Let's be healthy. Today we are going to unravel one of the fundamental concepts in understanding type 2 diabetes and insulin resistance. In this video, we will break down what insulin resistance is, how it develops, and consequences and what you can do about it. Insulin resistance, what you need to know. Insulin resistance is a key player in the development of type 2 diabetes. To truly understand this concept, we will start at the basics. What is insulin? First, let's understand the role of insulin in our bodies. Insulin is a hormone produced by the pancreas. Its primary job is to regulate the levels of sugars or glucose in our bloodstream. Think of it as a key and which helps you unlock the doors to your cells, allowing glucose to enter where it is used for energy. Now let's understand how insulin works. When you eat, especially when you consume carbohydrate, your blood sugar level rises. In response to this, your pancreas releases insulin. This insulin travels through your bloodstreams to your cells, signaling them to open up and let glucose in. This process keeps your blood sugar levels within a healthy range. So insulin acts as a facilitator, ensuring that glucose reaches when it's needed in your body, particularly your muscles, liver, and fat cells. The development of insulin resistance. Now let's delve into insulin resistance. Over time, certain factors including genetics, lifestyle, and environmental influences that make your cells less responsive to the insulin. This means that the locks on your cells become rusty and resistant to the key. Cellular resistance. Imagine insulin as a key fitting into a lock, allowing glucose to enter your cells. In the case of insulin resistance, the lock doesn't work as smoothly, your cells don't respond to it. Your insulin signals as effectively as it should be, and this results in higher level of glucose circulating in your bloodstream. To compensate for this resistance, your pancreas produces more insulin. This increased insulin production is an attempt to overcome the resistance and force your cells to let glucose in. Consequences of insulin resistance. The consequences of insulin resistance are far-reaching and impact various aspects of your health. Firstly, it leads to an elevated blood sugar levels, a hallmark of type 2 diabetes. This continuous state of high blood sugar can damage eventually your blood vessels, your nerves, and various end organs, increasing the risk of cardiovascular diseases even, kidney problems, and nerve damage. Metabolic syndrome. Insulin resistance is also a significant component of metabolic syndrome. It can be understood as a cluster of conditions that includes high blood pressure, abnormal cholesterol levels, and abdominal obesity. People with metabolic syndrome are at an increased risk of heart diseases and type 2 diabetes. So you see, insulin resistance isn't just about blood sugar, it's a complex web of factors that affect your overall health. Now let's understand causes of insulin resistance. Understanding the causes of insulin resistance is essential to addressing it. Factors such as genetics, obesity, sedentary lifestyle, and poor dietary choices are major contributors. Genetic can determine your predisposition to insulin resistance, but your lifestyle choices can significantly influence whether or not it develops. Role of obesity. Obesity, especially abdominal obesity, is strongly linked to insulin resistance. Fat cells, especially in the abdominal area, it releases substances that can interfere with insulin's action, further worsening resistance. Additionally, a sedentary lifestyle and a diet high in processed sugars and saturated fats can contribute to the insulin resistance by promoting weight gain and inflammation. Diagnosis and prevention. So, how can we diagnose and prevent insulin resistance? Diagnosing insulin resistance usually involves blood tests to measure fasting glucose and insulin levels. The most common test is HOMA-IR test, which calculates insulin resistance based on these values. Prevention strategies. Prevention is a key, and it's never too late to make positive changes to reduce your risk of insulin resistance. First and foremost, maintaining a healthy weight through a balanced diet and regular physical activity is essential. A diet rich in fiber, whole grain, fruits, vegetables, and lean proteins can help keep your blood sugar levels stable. Physical activity. Physical activity has a profound effect on insulin sensitivity. Exercises such as aerobic and strength training can significantly improve your cell response to insulin. Additionally, avoiding excessive consumption of processed sugars and unhealthy fats can go a long way in preventing insulin resistance. Treatment. If you are already developed insulin resistance, don't worry. There are treatment options available. The primary approach is to focus on maintaining the underlying causes. This often includes making lifestyle changes such as adopting a healthier diet and exercising regularly. In some cases, doctors may prescribe medications to help improve the insulin sensitivity or lower your blood sugar levels. These may include metformin, thiazolidines, and incretin-based therapies. The choice of treatment depends on your individual circumstances and the severity of the insulin resistance. In conclusion, insulin resistance is a critical concept in the context of type 2 diabetes. It's a condition that involves your body cells becoming less responsive to the insulin, leading to elevated blood sugar levels and a cascade of health consequences. Empowerment through knowledge. The good news is that by understanding insulin resistance, its causes, and how to address it, you can empower yourself to make positive changes to protect your health. Thanks for joining us on this journey through the world of insulin resistance. If you found this information valuable, please give this video a thumbs up and share with your friends and family. And of course, don't forget to subscribe and turn on the notification for more enlightening videos. If you have any questions or topics you would like us to cover in the future, leave a comment below. Remember, knowledge is power, and by understanding insulin resistance, you are taking a significant step towards a better health.